Hello everyone, this is DrDev. I am a Chief Medical Oncologist at Medicover Hospitals, Visakhapatnam. So today we are going to talk about a very important aspect of cancer treatment, that is the diet. Diet plays a very important role in carcinogenesis. Also, it also plays an important role in prevention of cancer. And in the treatment part, diet is very important. So the most commonly asked questions for any oncologist would be, what diet should we take? What diet should we prevent? And how much diet should we take? There are a lot of myths about this diet in general population. If you take this diet, that will delay your wound healing. If you take that diet, that cause more cancer. So a lot of myths that has been circulating, a lot of myths people believe in. So today I am going to clear all those myths. We are going to talk about all facts about diet in the cancer patients. So first, now let us talk about diet. Food items or food which could cause carcinogenesis or which could cause cancer. So food items like preservatives, the food which has been preserved a lot, and they add a lot of preservatives, and food which has been used, which has been cooked by using oils which has been used multiple times, and food items where a lot of artificial additives has been added. So these three food items could increase the chances of cancer. So always try to avoid food items which has been a lot of preservatives, which has been a lot of added artificial coloring agents or artificial additives, and also which has been cooked by using oils which has been frequently or used multiple times, which has a lot of tar and all those things. So if you could avoid these, then probability of cancer could be minimized by the diet. Second, what are the food items which can protect you or prevent you from getting cancer? So as such, we don't have any specific food item which could prevent or protect us from cancer, but it is general saying that if you add a lot of greens, for example leafy vegetables or general vegetables, or a lot of fruits in your diet, probably that would take care of or that could prevent cancer. So a lot of studies have been there which have shown that taking a lot of vegetables and fruits could reduce the risk of cancer, but we don't have any definitive proof that which food item could prevent which cancer. So it's to summarize that, always add at least one fruit a day in your diet, and take lots of greens, lot of green vegetables, lot of vegetables of all types in your diet. So next is regarding the meat, which again they ask. So if we take a lot of meat, will that increase the chance of cancer? Yes, definitely there are. If you take a lot of red meat, for example beef or buffalo, or these are considered red meats. If you take a lot of red meats, the chances of colon cancer or colorectal cancer will be increased. It's like you completely avoid them if you are taking, but it's just that you reduce the frequency of red meat in your diet so that the colon cancer risk could be minimized. Now let's move on to the other aspect. Suppose for example somebody has a cancer. So what diet should they take so that they keep healthy? The most important aspect of cancer treatment is to maintain your body weight, because most of these patients, they would have decreased appetite and they would have a loss of weight. So if the patient doesn't have adequate weight, or if they have loss of weight, then the tolerability for cancer treatment would be decreased. They would not tolerate any treatment options. For example, surgery, radiotherapy or chemotherapy, for them the tolerability should be good. The patient should be healthy. The body weight should be maintained. So to maintain that, you need to take adequate amount of diet. You should take good amount of calories, good amount of protein, and also fat. According to the NCCN or any standard guidelines, there are no food items which has been avoided, which has to be avoided, or which has banned in cancer patients. I think you can take almost all food items, whichever you feel like eating. So we don't have any specific contraindications or any no to any food items. You can take any food item which you like, but make sure that you take adequate quantity. You have to take infrequent meals. So I would say cancer patients cannot take a lot of food at one time. So the best thing is that what they can do is take multiple times, maybe 5 to 6 times a day, at frequent intervals and in a small quantity, maybe small quantity at increased frequency. That is what we recommend in most of our cancer patients. In certain settings like neutropenia, and it's always better to take well cooked boiled food at home. Better avoid taking food items which has been there on the streets, because a lot of dust and a lot of microorganisms. So it's always preferable or advised to take food items that has been cooked hygienically at home, and take good quantity of food at multiple times with more frequency. That would avoid your nausea, vomiting in those treatment options, and also maintain your calories and protein intake. And try to take a lot of protein in your diet, because that will prevent your catabolism. So that is also essential to tolerate the treatment options which you are giving. For example, chemotherapy or radiotherapy, where there a lot of catabolism happens in the body because of these drugs and these procedures. So to avoid that, we need to take a lot of proteins as well. So take a lot of proteins, for example, egg, fish. These are easily digestible proteins. So you should take these proteins very often, almost daily in your diet. And don't forget to take a lot of vegetables and fruits in your diet. Whenever you are taking fruits, so always try to take fruits which we can take off the skin, or which you can peel off the skin, so that we can remove if any pesticides or if any microorganisms that has been there on the skin. So this is all about diet. If you want to know further any details or more details about the dietary aspect of any cancer patients, please visit Medicover hospitals and oncology department. We would be more than happy to help you out. Thank you.